I've been reaching out to different health officials since last week. I had a viewer say that he couldn't find the vaccine for his kids. He's in Cottage Grove and he has a 97-year-old mother living with them. And I reached out to the same pharmacies that he reached out to there in Cottage Grove, and then a couple here, kind of to compare. So it was Fred Meyer, Walmart, um, Walgreens, and a couple others. And outside of Walmart, all of those pharmacies, I couldn't book an appointment for the COVID vaccine unless I put in a certain age. Now, I'm not saying that these chains aren't allowing the vaccine, but it's odd that there are no appointments to set when you put in those numbers. So my question first was, is this something you're noticing? Are local chain pharmacies vaccinating kids under 18? Is Lane County vaccinating kids under 18 at your clinics?
And you're just talking about COVID, correct?
COVID, yes.
Yes. So COVID is clearly, of the big three that we worry about this time of year, influenza, RSV, and COVID. COVID is the most challenging right now because of this uncertainty in terms of the federal recommendations. So my short answer to your question is Lane County is providing vaccine as we receive them for kids in the COVID space, the influenza space, and the RSV space. The challenge that we have, and the bigger answer is private sector pharmacies and clinics are having to make a decision. Given the uncertainty, how much of this vaccine are we going to need this year? And therefore, how much should we buy? And that's an individual decision and it's a challenge. And I am not surprised that we're hearing from parents and guardians that it's difficult for them in some instances to get the vaccine for their kids. If there is good news here, the good news would be right now there's no shortage of any of those vaccines. There's no shortage of flu vaccines for kids or adults, vaccines for COVID-19 or RSV. So there's no shortage. There's just a shortage of access because of the uncertainty.
A shortage of access. I feel like I need a better understanding of this.
So um, I know you've been in our community for a time, beginning about, I think it was about 3 years ago, Mart, it's a local store that used to have pharmacies. They made the business decision to close 56 pharmacies. There were 56 of their Mart pharmacies in our region. Now they're not all in Lane County, but here in the Pacific Northwest, and they closed 56 pharmacies. Some of those were purchased and bought up by another pharmacy like Walgreens, but some of them there was no other competitor nearby who wanted to take over those patients. So we started to see a decrease in access because of some pharmacy closures. Fast forward another year, year and a half, and I'll be honest, I never thought in my clinical practice that I would see pharmacy closures and have a problem for my patients to get medications. But over the last couple of years, we've had pharmacy closures, not just Mart, but we've had other pharmacies close because of lack of pharmacy staff. So that's a challenge. And then there's consolidation at the national level and some other pharmacies going out of business, like Rite Aid, for example. You've probably heard about Rite Aid's financial challenges. So yes, especially in the pharmacy space, there has been a decrease in access for many patients.
So no shortage of the vaccine, just a
Correct.
shortage of pharmacies to disseminate it.
And beyond pharmacies, because if you think about it, um, pharmacies aren't the only organizations that vaccinate. Clinics vaccinate, hospitals vaccinate, urgent cares vaccinate. And some of those entities are making business decisions that, maybe we shouldn't buy so much this year. I'm worried that we're going to waste more of it and lose that money because there'll be less interest in vaccines this year because of the uncertainty and the misinformation and the disinformation that we're hearing in social media, etc.
With the county, with Lane County's clinics, you said 8 clinics in the past, right?
We have 8 primary care clinics, and we're in the process of consolidating a couple of those clinics into a remaining of 6 clinics.
Within your clinics, do the kiddos need prescriptions to be vaccinated with the COVID vaccine?
So, are you familiar with the West Coast Health Alliance?
I am.
Okay, so we are following the West Coast Health Alliance recommendations. So all kids 6 to 23 months are eligible for vaccines, and they don't need a prescription for that. If their provider, whether it's a nurse practitioner, a physician associate, if they see the patient and this is a patient who would benefit from the COVID vaccine, they will be provided the COVID vaccine. Again, COVID is the hardest one because it has had the most changes this year. I think it's also worth noting that influenza, for example, it's exactly the same as last year. Everybody 6 months and older should get the vaccine. The CDC has ruled on that, as has the Advisory Committee on Immunization Practices, ACIP.
With the West Coast Health Alliance, with what you said, they're not just advisory here. That what they're saying, their recommendations supersede the CDC's here in Oregon.
Well, it's interesting. I am not a lawyer. The West Coast Health Alliance, those 4 states are making recommendations that will fit under the footprint that the states control. So, for example, Medicaid. Medicaid is a federal and state program, and states kick in a whole lot of money into Medicaid, including in our state here, billions of dollars of taxpayer money from the state of Oregon go into Medicaid. And those are the recommendations for the Medicaid population. And this is probably more detailed than you want. At our clinics, the community health centers of Lane County, a large percentage of our patients are Medicaid patients. So we are following the Coast Health Alliance recommendations for our Medicaid patients, which are 3/4 or more, depending upon the month we look at it, of our patients.
And so I spoke with Jonathan from OHA last week, and he said that now that the CDC has kind of put out their recommendations, they're expecting more vaccine. Um, will this impact, do you think, the broader community in terms of accessibility? If right now those pharmacies are saying, we don't have kid appointments, but more is coming in. So should parents start to see more access?
We are expecting more access in the coming weeks as we get a bit more clarity and those private sector practices decide to enter this place of vaccinating kids. It has been so uncertain. And I'll give you an example, Gold, that is applicable each year. Um, Practices buy these vaccines, they put them in their refrigerator or freezer, depending upon the vaccine requirements, and they use most of it, but some years they don't use it all. And these vaccines are not inexpensive. The flu vaccine is pretty cheap. You can get it for, under $50. The COVID vaccine is quite expensive, 3, 4 times that, depending on where you go. And if you have 100 COVID vaccines that don't get utilized, you're looking at thousands of dollars. If you have 100 flu vaccines, you're looking at fewer dollars. So this is a significant investment for clinics to buy these vaccines, store them, keep them at the right temperature. If, for example, the refrigerator temperature gets too warm on a Saturday, there has to be an alarm. Somebody has to come in and take a look at it, see if the vaccines are still safe, take them out of that refrigerator that died, put them in a new refrigerator. This is a system that takes a lot of work, and consequently, the decision to invest in that has to be one that's really based upon the planned workflow. And I think that the uncertainty has caused many practices to question how many of these vaccines they should buy this year. And that's how we're seeing it play out in terms of decreased access right now. But it should get better.
And last question for you, Dr. Ledke. Are you seeing more kiddos being vaccinated than before in the past, or is it kind of the same? How does that work for you all?
So far this season, we're not seeing an increase or a significant decrease compared to prior years. That being said, it's really important to note that the uptake in our various populations of, for example, the COVID vaccine has not been high. In the adult population last year, it was only 20% of eligible adults. In the child population, depending upon whether you're looking at very young kids, the so-called littles or adolescents, it would be vary between about 10% and about 30%. So we have not even come close to 50% of eligible people getting these vaccines over the last year or two. So there is nothing but room for improvement.
So there's actually not that much of a demand for the vaccine, is what you're saying.
Yeah, last year there wasn't a lot of demand. This year I think there's more phone calls I am seeing, and I wish I could give you absolute numbers, but I don't have those numbers. There's more uncertainty, and consequently there are more phone calls. We'll see if that translates into a higher vaccine rate.
Got it. All right. Anything else I'm missing or you'd like to share with our viewers?
I guess the one thing I would share is the science hasn't changed. The politics has changed. These vaccines are not perfect, but they are effective in doing what they are designed to do, which is preventing severe disease. And we need to take advantage of those opportunities. And we as a community, we need to do more of that. We need to protect ourselves, protect our family, protect our community.
Awesome. Thank you so much, Dr. Leckie.